Well, y'all are in for a damn treat. We have doctor. She's insisting that I only call her doctor. I'm just kidding. We have Denise. Okay, I'm going to say it. Ahmadinia. Is that right? Ahmadinia? No.
Yes, heard it.
Really?
Yep.
No. I'm putting an N in there where I don't. Ahmadinia.
Beautiful. Nailed it.
But you say it.
Ahmadinia.
Ahmadinia. Okay, perfect. Licensed psychotherapist, licensed clinical psychologist. Welcome aboard. How are you feeling about this?
Excited to chat.
So this is where I like to start.
Yeah, I'm getting off back surgery, and you're
Oh,
like,
yeah, you did. How is that going?
it's great. You're the person that I'm like back in the mix with. So I'm so happy to be
What
here.
was wrong? What was going on there?
Well, I had a disc replacement in my low back, years of back pain, injuries, and, body communicating things as well. But I'm on the recovery side now.
I'm going through that.
Right.
I've had years of neck and shoulder stuff that I've just put off because it's not been that bad, right? And I finally did something to it to where my whole arm was numb for like, I don't know, a month. I finally went and got x-rays. I don't need a disc replacement, but like I'm like phase 2. I would if I don't get a handle on this. And it's really hard to know what is the right way to treat this. And I know that so much of it is somatic, but it does feel overwhelming to figure out like what is the best way to treat this and what is the best way to treat that this isn't going to cost me like $5 million.
Yeah. Surgeries aren't cheap, that's for sure.
Yeah. Well, or I mean, to get like an amazing, like top of the line somatic experiencing person with body work.
It's just so fascinating when you have like a structural, like, there's a structural issue, but also a part of you knows it's not just that.
Exactly. And how do you do both?
That's important because there are some people where like there's no structural damage and you can see like, yes, this is clearly my body carrying something. But like when those two collide, figuring out where you're going to intervene and how much you're going to push in one place, I think that's almost trickier.
Yeah, instead of it being just like I have like stomach issues or yeah.
Right.
Yeah, exactly. Yeah, totally. Well, how's the recovery going to be? Like, are you
I mean,
good
I'm
to
3
go?
weeks in, so, I might stand up and take a little break while we're
Go for
chatting.
it. You can do whatever the hell you want.
It's amazing. I'm grateful I have an amazing husband who like literally handles everything and the kids so that I've been able to rest and recover. And it's been the first time in a long time in my life where I've had a space to like just take care of myself, which as like a survivor, as a mom, like though that experience it's gold. So I feel like I'm coming back in a very different grounded place than I've been before, which is great.
Have we done any like good TV binges or what have we done?
A little TV, not too much. I watched Monsters. I watched the Menendez Brothers story. I watched the new Kristen Bell for something lighter.
What is that? A movie with her?
It's
Or a
a
TV show?
yeah, Nobody Wants Us. It's a cute little kind of romantic comedy. And then honestly, just like lots of sleeping, lots of rest, like slow mornings, like a lot of time to journal and sit outside and go for short walks and nothing too exciting.
Okay, so here's where I always start. When was the moment that you realized that your childhood screwed you up more than you thought it did?
Beautiful question. I don't know if there was any one like smack me in the face moment. I think for me, it was a series of smaller revelations of that. The first, I think, really hit me when I was in grad school, because when you're learning about understanding being a human being, you're inevitably thinking about yourself and applying all of that to yourself. And that's, I didn't go to therapy as a teen. That wasn't even something that would have been on the table. So like that was a foray for me into like that self-examination. So that was the first layer. And then I think for me, like part of how I coped with my trauma was keeping everything so close to my chest, keeping everything so repressed and pushed down that like there weren't people I spoke to about experiences, which I know is something that happens so much, not just trauma in general, but like in a dysfunctional family system where there's this like unspoken
Don't talk rule.
Yes, to not talk about things, which obviously perpetuates all the shame and self-blame and all. So I think as I ventured into more vulnerable relationships, whether it was like friendships or my now husband, you see these memes on Instagram of like you don't realize how horrible something is until you see the reaction on someone's
Yeah.
face. There's so much truth to that where you're like, oh yeah, here's this story. Or like my sibling and I joke about this thing. But then you see somebody's reaction and you're like, oh, that didn't happen. Or like, okay, maybe that happened to like one off, but that wasn't like
A
everything
normal.
normal. So for me, it was like layers that unraveled. It was not one big hit me in the face moment. And I think I'm grateful for that because that's been a theme in my healing journey. And I think my body has done I'm so grateful, like just such a beautiful job of revealing layers of things as I could handle them. Because had I been hit with the truth of everything all at once,
Too much.
Yeah.
Yeah, and the subconscious is so amazing in that way, right? It like never reveals something until we're ready to deal with it. What was I going to ask you? Oh, I was going to say that anybody who on the very first day of like grad school, or even like if somebody wants to study psychology for their bachelor's, somebody needs to go up to them and say, listen, like if they've never been to therapy or anything, and be like, listen, there's a reason that you want to do this. You know, like I really think there has to be always, right?
When I got to my doctoral program, one of my beloved professors did that with us in a small group and kind of encouraged all of us to be like, how did you end up here? Right? And like the common theme, when you leave out all the details, is like you somehow became the listener or the absorber in your family. But that's like, 2 years post-master's in the first year of a doctoral program, like you've done a lot of work to get there already. And some people still, I don't say won't have the capacity, but sometimes not ready or not willing to do that because it is so easy to go into this profession and take that like expert vantage point that distances you from your lived experience. And I wish grad schools did a better job of bringing those two things closer together because I actually think some of the best healers I've had in my life and that I know personally are the ones who've joined those two things.
Have you ever read the Adult Child Laundry List?
I have not.
Okay, here we go, girl. Let's see what is. So these are the 14 common characteristics of an. So initially it was adult children of alcoholics, and that was late 70s, early 80s. It was just to give you information about it. It was a shoot off from Al-Anon. So it was these teenagers who had been in Alateen who then like graduated into Al-Anon and realized that they could not really relate to what was being shared in Al-Anon because it's mostly people talking about, their spouses, and they were trying to deal with the aftermath of having grown up in an alcoholic home. And so they started their own meeting, and then they realized that regardless of their specific details of their upbringings, that they had these characteristics in common. And then it was like literally probably less than 10 years later that they realized that like these characteristics are not unique to just an alcoholic family, and that there are tons of different dysfunctional family systems that could produce an adult child. And so for me, finding this for the first time, I was 7 years sober, and because I couldn't figure out. So for me, it was showed up in dating, and I couldn't figure out like why my picker was not getting any better. And I had no idea that what I was experiencing was complex PTSD in relationships. No idea. Had been in therapy. Nobody was pointing it out. And then the real aha moment for me was, and I don't know if you've seen me share this at all on Instagram, but it was a guy that I dated, Brian number one, for less than a month, and he ghosted me. And my reaction was as if my husband of 30 years had like tragically died in a plane crash. And it was the realization that one, there's no way that the reaction I'm having right now could actually be about this person. And two, that this is the same feeling that I felt when I would wake up in the middle of the night and felt like I was going to die if I couldn't sleep in my mom's bed. So, and then it would take me another Brian number two to really realize how much I'd been impacted. But when I read this, it really deeply resonated with me.
So many people like relate to that story because you're obviously our attachment relationships and everything that happens in our families shows up so much more in your face in dating relationships.
Dating and parenting.
Dating and parenting. And I think that's why we see these big spikes and like these realizations and digging into the work in like mid to late 20s and 30s and beyond, because you have these like really impactful junctures in your life where you're fighting yourself. You're trying to move towards intimacy, but all the all your old stuff is getting in the way.
Yeah. And each relationship was like building upon, the next one, because I just kept re-traumatizing myself. So when you look at this, I'm curious, what are ones that would have resonated the most with you?
I think sort of like the combination of 1, 2, 3, and 6, somewhere in there, throwing the one.
So, yeah, hardcore people pleaser.
Yeah, hardcore people pleaser, like that combination of obviously like the theme of lack of safety for me was both emotional and physical in so many ways. And I think I realize now how skillful all those things were to like, yes, in my teens and 20s, it was so hard to not know who I was or to feel such intense guilt for standing up for myself if I even dared do it. But I have so much gratitude now, having done so much work, for a younger version of myself figuring out that like you just needed to push all of who you were to the side because there was no other way to stay connected and to feel like you were worthy or lovable unless you became the listener, the pleaser, the caretaker, the parent, the emotional container for everything. There was no way. So I absolutely, like, that cocktail of things stayed with me for a long time. It's still there to some degree too.
What were some of the experiences that you were having in young adulthood? Like, where was this showing up in your life?
I don't think I even noticed it showing up until maybe I was like college age. Looking back, I can see where it was showing. The realization, I think, was when I was in like deeper romantic relationships. I mean, similar to you in a way, where, for example, having a fight with a partner, the level of fear and what my mind would be anticipating would go down after that. And then if I would feel willing to share that with whoever the partner was and hear the reaction of like, you thought that was going to happen? Like, I could never do that. Or like, just like that disconnect that what I was conditioned to anticipate was so far off of what was happening in the here and now. And not only that, but like opened the discussions about like, why would you think that? I think that's when it really started to like, especially the fear piece, right? Like the fear, the disconnection, the anger, the lashing out, the potential silent treatment, like all of those things is where my mind and my body would go. Yeah.
Were you more of an anxious attacher?
If I'm being really honest with myself, I think there was a point in my life where I was actually more towards disorganized. I think whatever I attribute this to, I have had people and healers and loved ones come into my life, mentors, and even being in this profession, I think that helps me navigate out of that unknowingly. But that's actually where I think I would have been, if I'm being real.
Before you started having these realizations, how would you have described your experience? Or what did you think your experience was?
I think the story that I carried for the longest time was we are a really close-knit, loving family. Sometimes there's tempers or big conflicts, and that growing up was often attributed to like cultural things. And it was sort of like this cutesy, like nuanced throwaway thing. So that was like this tiny little piece over here, but like at the forefront was, which now I realize was the image that I was, taught to portray. And still, like even as I talk about it, right, I can feel that dilemma around it. But it is a very different story than what was actually under the surface.
And so how would you describe the breed of dysfunction in your family?
Generally, the dynamics were volatile, unpredictable, would go from loving to explosive or very reactive, not just one parent, both in different ways, all the way to sort of pretty emotionally neglectful or punishing. And I'm leaving out some of the physical stuff on purpose for a number of reasons, but all of that was present.
And do you have siblings?
I do. I have an older sister.
Okay. And so what role did you play and what role did she play?
We certainly cycled through different roles at different times. I definitely identified a lot more with the experience of the scapegoat growing up. And I'm sure there would be people in my family that disagree with that. But gosh, when I started learning about that, you know how it is when you see yourself in something, you feel that relief, but also that grief at the same time when something's validating for you.
Mhm.
The level, I think for me, like the level of shame that I carried for so many different experiences and traumas, a lot of it hangs around that role too.
And what was your relationship like? Were you guys close?
Very close,
Mhm.
very close. And we're still pretty close today, just to kind of catch up to present day. But we've gone through a lot of this to get here. My mom sort of raised us like twins because we're 2 years apart. We look a lot alike. We did all the same activities, which, again, one of those stories that sounds really sweet as a child, but then you realize like there was no place for identity for anyone anywhere. But we were very close growing up. It was just the two of us. We shared a lot of friend groups. We did a lot of shared activities. But I have to say, it's been a very hard journey between us some of the time as we go through our own growing pains, because we both experienced same things in a different way, similar things. But to have a sibling, and I know not all people have this experience, one, to have a sibling to go through your childhood with, and two, to have a sibling that's also now willing to start to do some of the work as well, is a gift that I wish I could give everyone, because to stand alone in that is such a different experience than to have someone who was a witness to it and to you in the same way, even if you have differences or struggles. I think a lot of times with dysfunctional families, toxic family members, especially if you're the scapegoat, you stand alone. You don't have a united front. Like the family is the united front. And for me to have a sibling, especially at this stage, there's a different united front that has formed.
And so then what has healing looked like for you? Would you say you've had phases?
Absolutely. I've had phases where, when I first started going to therapy, unknowingly, I just couldn't get to this stuff.
Of
Just
course.
couldn't. And I wasn't getting what I needed because of that. But my healing has been certainly in phases, willingness and readiness to tackle different things at different times. But I think the two biggest kind of pushes in my healing were in my relationship, before I was married, going through the growing pains, because we were together about 5 years before we got married, and, in early 20s. So went through a lot of those 20s growing pains together. We've been married almost 9 years now. We've been married. And parenthood. Those two relational things, and also like, reminders. I think when you see your child unknowingly, like not a conscious process, there were things that happened to me in early motherhood, fears that I had, anxieties that I had, that didn't make sense to me until a couple of years ago when I started digging into some of these things, like the anxiety of leaving my kids with anyone. And of course, like there's a good deal of that that's just like normal motherhood anxiety, especially as a first-time parent. But like the extent of it to me makes so much sense now, knowing what I know about my history and my childhood trauma that I experienced. So I think those two markers in my healing have been huge, and I wouldn't have been ready any other time to do what I've done now.
Were they repressed memories?
Yes. Yeah.
And you don't have to share about the specific memories, but how did they come to you? Was it a felt sense? Was it visual? Did it all come all at once? Was it at one time?
Let's see. This was more than a couple of years ago. Was processing a sexual trauma at 17. Knew of that one, was conscious of it.
You're in high school?
I was in high school. It was a situation where I was drugged, but came to partly through it. So I did have some like conscious memory.
And sorry not to interrupt you, but did you did you tell anybody about it?
No, because I didn't tag it as that until years later. Yeah. Didn't even understand that, like what I described happening in my body. Didn't realize that that's what it feels like when you're drugged.
Okay. So you thought that like you had agreed to it.
I thought that I drank too much and blacked out.
Got it.
Didn't understand the circumstances until I shared it with one of my dear friends years later. And it opened the door, right? One of those reactions that you get from someone when you talk about these
Oh,
things.
that's not normal.
Right. So I was processing that I was conscious of. I had a wonderful therapist I worked with at the time, where I was doing a lot of somatic and sensory motor work, also working on family stuff and boundaries, all of that converging at the same time. And there was just like residual stuff in my body that I couldn't work through. And it was affecting my relationship, especially intimacy, as sexual trauma does. And we just couldn't quite figure out like what was going on, that we weren't seeing the resolution that we should have been seeing with the work I was doing. For me, that opened the doorway to like being really honest with myself about a sense that I had carried for so much of my life, that something had happened to me earlier in my life. And it was like words I had literally never spoken out loud to anyone, because you sound crazy, you feel crazy. And I had to be really honest with myself as all of this was coming together, that that was something that I needed to explore. And it was all waiting for me. And I'm still in the healing process of all of that. And I never want to give anyone the impression, especially as a therapist, that like we're all buttoned up, we're all healed, and it's messy, and there's layers that come and go and all sorts of things that come and go through it. But that has been, that's still unfolding in terms of how that fits into the family narrative, who was involved, and all sorts of complicated questions. That common experience of having a lot of holes in your memory. And I think something that I've realized is so much of my childhood memories were from pictures and videos that I have. They weren't actual memories. And they were all the happy ones, of course, because that's what's documented. But so far, just me.
And how has that been as far as your sense of self, or has it been hard to accept it?
As far as my sense of self, I don't think I've ever gotten close to a sense of wholeness the way that I have in this healing process. And to me, like I can literally see the parts of myself split off, everything I had to hold. Like I think that wholeness comes from allowing all those parts and those memories and experiences to integrate, to allow them to be there. So that wholeness is something that is wonderful. It's radically shifted my view of self, my gratitude for my own body, the way I relate to my body. I appreciate the wisdom of my body. There was a part 2 of what you just asked that I lost.
Accept it?
Oh, acceptance. Yeah, that's an ongoing battle, I think, as things have unfolded. You were talking about IFS before we started, and parts work and whatever names you put to it. But I think as I've gone closer to doing the hardest work, all those parts show up and start talking. And that's everything that we've all internalized, right? Like who was in your life that like dismissed, invalidated, denied, doubted. So it's not that those things have disappeared. I've gotten a lot more skilled in working with them. When they show up, I understand why they're there, how they protected me, why they needed to be there. But like my process has been working with them to kind of catch them up to my adult self, the safety I have now, the skills and capacity and resources I have now, so that they don't have to work so hard, because I'm in a place where I don't need them to do that same job now.
What's been your experience with doing parts work?
Yeah. I first actually got introduced to it when I was doing training in self-compassion work, because self-compassion work actually uses a lot of that without necessarily using the same terminology.
Is that like what, like Kristen Neff or stuff?
Yeah. Yeah. So part of my fellowship, I was trained in mindfulness-based stress reduction, mindful self-compassion. I just ate it up,
What was the first one? Mindful what?
Mindfulness-based stress reduction.
Okay. What the hell is that?
It's an 8-week kind of evidence-based mindfulness program that was originally developed for chronic pain patients, but it's widely researched now, all sorts of benefits for chronic pain. I mean, I went to it for chronic pain even after my training because of my back issues. But it's widely researched now because they've done a lot of the brain scans and the neuroscience behind like 8 weeks to change your brain through a continued program like that.
How intense is it?
Well, that program is very intense because you're building up to lengthy meditations. And that program is not for everyone. I teach and I do a lot of mindfulness in my personal life and in my practice with my clients, but I do it with a very trauma-informed lens because of like what the nervous system can tolerate, and like the experience of like being still and quiet or closing your eyes. Like those are all things that have to be very tenderly worked with.
Well, how does the parts work factor into that stuff?
I talk about this a lot in my program. Mindfulness is not the only way to do this. It's like one very direct route in, but parts work, connecting to your inner child, connecting to your authenticity, being able to set boundaries, all that stuff requires you to be connected to yourself. Because you have to know, what am I feeling? what does a yes feel like? What does a no feel like for me? What does, anxiety feel like? You have to know that, because all of that's information for you to meet your needs, to take care of yourself, to protect yourself. So that factors in as one way to get embodied. There's so many ways that, like, so many embodiment practices, right? Like yoga, spending time in nature, dance, all sorts of movement practices, but anything that connects you to your body. We're not talking about connecting to our mind necessarily. Most of us are pretty connected there. It's like below the neck that we've been disconnected from so early on. So we talk a lot about that in the program and in the individual work that I do, because it's the foundation for being able to do so many other things. Right? So even with parts work, you're doing a lot of noticing and tracking, right? So you have to be able to connect with what's happening in the here and now in order to do that. And that looks different for different people, depending on what your capacity is and your level of awareness, your level of, what you can sit with and tolerate at that time. But without it, it's much harder to connect with all those parts.
I'm curious if what related to your back pain, like, was there any parts aspect of that? Were you able to connect with that pain at all? Or I'm just curious if the two connect. How did that connect at
My,
all?
my sense of it now, knowing what I know now, is I certainly had many, many injuries and car accidents that, like, the structural issues were there, like I was bone on bone. But I think the pain was exacerbated by two things. I think it was my body's way of almost like holding something, saying, I'm going to hold on to this for you. I'm going to let you know I'm still here, but I'm going to hold on to it until you're ready. So I think it was something that just continued to bring my attention back to myself. And secondly, as my healing has unfolded, there were traumas that happened that involved that part of the body as well, where that part held a lot of tension and bracing. So lots of pieces to that. So honestly, getting that surgery has been a really interesting experience of literally almost like energetically feeling things cleared out.
Yeah, I bet you feel great. How long have you needed to have the surgery?
Years. I had one back in 2016 that was like a lower level surgery. It wasn't really what I needed at the time, but I was too scared to go for the big surgery. So it gave me some relief, but it's been years that I've needed it.
So I see that you talk a lot about the fear of being seen.
I never expected that to be a topic that was so widely asked
Resonated with people? Yeah.
and resonated. Absolutely. Because I think, right, just what I was talking about, that disconnection between who you really are and who you have to present as. I know Gabor Mate talks widely about this, like that battle between authenticity and attachment. I think fear of being seen is so much wrapped up in that, right? Because if we've had to hide our authenticity, whether it's like your emotions, your opinion, parts of your identity, whatever you might relate to in terms of feeling like you have to hide something or keep something smaller, that fear is always with you, even when you're presenting that more wrapped up version of yourself, that more acceptable version that's going to be approved of or safer to present to people. And I think people can relate to that almost regardless of what kind of experiences they've had to some degree, right? Because we all, as human beings, like, we all want to be accepted into the community, into the group. Like, that's just how we're hardwired. That's why we have shame. There's always a bit of fear of rejection in there. That's normal. When you've had trauma, of course, like, the threat of that is so wildly different than like the average human being who hasn't had those experiences. It's like such a visceral experience, the level of fear, the lack of safety that it feels like to show those parts of yourself. And again, I think we see so much of that in relationships, right?
Absolutely.
Like, if I'm hiding who I am, and this is something I was literally just talking with a client about the other day. If I am hiding who I am for safety, and I'm in relationships, even if these are like wonderful, safe, supportive people, I'm not being authentic. I'm not being vulnerable. And when I'm not doing those things, I can't actually get my needs met. So I end up reinforcing the experience, the feelings, and the beliefs from childhood that I'm not seen, I'm not important, my needs don't matter, or people don't understand me. And it is this like very delicate dance, especially relationally, where we do have to, at some point, be willing to take some small vulnerable step forward. And of course, we have to see how that's received to like really gauge if someone's safe and trustworthy to continue doing that with us. But it's something that I think we all struggle with to some extent, but 100% when you've experienced a dysfunctional family, a narcissistic parent, childhood trauma, trauma around your identity, whether that's your gender identity, your race, all sorts of things, we get so skilled at not being seen.
And so what is a small vulnerable step?
That would look different for everybody. It depends on where your fear of being seen shows up. So like I have some folks that feel like they've done a lot of work in their relationships and it's showing up for them in their work. Right. So that would be where I would say we have to figure out what a tolerable, like a risky but tolerable step for you would look like. Whereas someone who is showing up in their relationships, that would be like a different vulnerability that they'd have to be willing to share. So it would really look different for everyone, but I think you always have to think about and ask yourself, what is it that I'm not sharing? What is it that I'm hiding? What makes me feel anxious and unsafe to share? And this is not about like going and being open to everyone and everything in the world, because that's also not skillful. We have to be discerning. And that discernment is something we lose with trauma. Our safety beliefs and experiences in our nervous system just like override everything. So like everyone and everything is unsafe to do, or the opposite direction, right? We can like overshare and that sort of thing. So this is about discernment, but also about what would help me feel more connected, what would help me feel more authentic, and you specifically being honest with yourself about what parts of yourself you've been keeping small or quiet.
So where has this shown up for you?
I mean, it's showing up right now.
I'm curious, like, what is a couple things. So one is we have the fear of being seen, and then is trauma dumping another manifestation of the same issue?
Tell me more your thoughts.
Well, when people overshare, I mean, I'm somebody that it's the opposite for me. Like, and I've had to learn how to scale back some. Although I was thinking about it from like a dating perspective that like, should I really, I mean, obviously I'm not going to dump everything on them on a first date, but almost wondering if I should like pull my personality back a little bit in the beginning. And I've realized with that, no, it's just not possible. And yeah, I'm a lot. And I mean that in a good way. Like, I am me, and yeah, it's gonna take a strong, secure man to handle that. So I think it's a balancing act between maybe holding back some of my story, maybe holding back details, but not holding back
Difference
me.
between your personality and your story.
Yeah.
Yeah.
Not holding my personality back, which, let's be honest, folks, I can't fucking do anyway. So that's the truth.
I mean, that goes back to that discernment, right? Is like,
Mhm.
I might feel comfortable to share all of this, but like, is that actually skillful for me to share such vulnerable information? And I don't want to assume that this is what applies to you, but as you were talking, I was thinking about, with trauma, something that can happen is we can sort of almost see danger everywhere, or we see danger nowhere. The way that it kind of messes with how we sense cues of safety or danger, really different person to person, right? So like that spectrum where on one end, I might fear so much or feel so unsafe, I don't share anything.
Mhm.
On the other end, there's almost been like a desensitization around that I'm not discerning about who I share with. I share a lot of things, or I attach to people really quickly without having that internal compass check in with myself about what this feels like, reading the cues of someone. Does it feel safe? Does it feel comfortable? So they're slightly different, but I can't help but think about how trauma can impact us in that way as well.
Yeah, and you know what I think what it is for me? Well, a couple things. First, that's my superpower, is like my vulnerability and my ability to open up. And I think about how that's how my higher power uses me a lot of the times. I think about, and a large story in creating this podcast is all of the crazy interactions that I had with strangers that were so impactful because I just am me and open up immediately. Right. So it's more about not doing that. It's picking up on the clues when I'm making somebody feel uncomfortable. And that's something that I used to not be able to do. And then I would just make things like real fucking weird. If I like meet somebody out at a bar and I just like don't stop, you know? So it's not really about like learning not to do that, but it's like learning how to sense when like somebody's getting real creeped out by me. But the other part of it is what I really think part of it is who I am. Part of it, though, is a deep desire for that intimacy, right?
Absolutely.
Wanting
There
that,
needs to be
but almost in a maybe in a too quickly, or it's hard. I think it's hard when you're like in this world and you're in recovery communities or, traumas when people are doing this deep work, like you just get connected quickly. But I understand in certain situations, like that's not appropriate. But I think that's what it is. It's like, I don't like fluff. So part of it is that deep desire for that closeness. I'm sure that part of it has to do with the fact that, like, for many years, I was the girl that nobody was allowed to be friends with, like I was the girl that nobody liked. So I'm sure that comes to, I'm sure also it is a deep desire to be seen. I think it is also a deep connection with too much of my identity being in the trauma and the pain because I was the girl that got sent to rehab in 8th grade. You know what I mean? Like this is who I've been. This is what I talk about. This is the role I've
how do
always
I
played.
separate out my personality from my stories?
Yeah. And that's how I was in my, like, it's just, it was like negative attention is better than no attention, And so that was my role. That was my persona. And I took that on, like, when we talk about toxic shame and the shameless acting in and the shameful acting out, it's like when I became the school slut in the 7th grade and the girl that no one would be friends, I didn't really lean into the I'm a slut, but it was like I leaned to the like, this is me and I don't really give a fuck what you think about me. And, like the girl that went to rehab, I'm not going to be like ashamed about that. Like I'm going to own that. Like, so I think that's part of it too. I do think on both ends of it, it's a desire to be connected and to experience intimacy. And
Absolutely.
one is like going too far. And on the other end, you're really holding yourself back. And I'm also wondering if like I wonder if like more of the scapegoats are more of the trauma dumpers.
In my experience, it's a mixed bag. I haven't seen necessarily a consistent pattern to that.
Mm-hmm.
I think one consistent pattern that I do see is that folks who have been through early trauma have a low tolerance for small talk.
Mm-hmm.
When you've
So
spent,
boring.
right? You've spent so much of your life not having deep supportive connections that you do just want to get to the good stuff. You do want to get to the deep connection. And there's nothing wrong with that. Like that's something that's biologically hardwired into all of us is this
Mm-hmm.
need to be seen, especially with our parents, because being seen is tied to being loved and being loved is tied to survival. And so even as we grow into adults, like we still have that need. So it makes so much sense that there's a part of you like putting forward all this vulnerability to have someone meet you there so that you feel seen and contained in that. That just makes you human.
Yeah. And just like it's just somebody who's not able, it's so fucking boring. I just don't. I'm just not. I need real, you know what I mean? Like I need real. That's like with my parents, it's like just their inability to go there. And we were talking about last night in my community support group was we were talking about the second laundry list trait about becoming approval seekers and losing our identity in the process. But it said a line and there was a line that talked about, having our parents not really know who we are. And I was saying that like what's even sadder than that is that they're incapable of having a desire to actually know us, and
I
that's
think
sad.
it is really sad. And I think when you've experienced that, there's so much grief to go through in that process. And it can feel so overwhelming as an adult because where do you get your sense of self? Like when you're a child, you get your sense of self from the adults that like mirror back to you. Like you're good, you're worthy, you're kind, like all of those things. So if we don't get that, it makes it very hard for us to have a sense of self. And we might attach it to other things, other identities or experiences. But I think that's such a common experience when you have a parent who's kind of on that spectrum of emotionally immature to narcissistic, especially because that tornado is so much about them and everyone knowing them and how great they are, what they did, that you as the child are so unimportant who you are that you don't even know that you're not known until you get to adulthood and you're going, who am I? What do I like? What do I want? Do I like these kinds of people? Do I like this kind of music? Because you didn't have someone mirror back to you. And if you did, if that unhealthy parent did mirror back to you, it was probably a lot of guilt and shame because it was their dysfunction that they projected onto you.
Yeah, I never really deeply resonated with like we became approval seekers and lost our identity in the process because I felt like, well, I turned into the scapegoat. But in a way that was, in a sick way, that was approval seeking in the sense that like I was allowing them to not have to look at themselves, or I was allowing them to, not go deeper into their sickness and disease in a way. So, and then it's like what you were saying earlier about how these brilliant coping strategies that we take on, but yet it's just like, then it's just the unraveling, to find that fucking identity. Who the hell am I?
For me, so much of finding that identity really came with connecting back to my body. Like even just on a basic level, like what I want and what I don't want, like being able to listen into my body to say like, I'm not sure. Yes, no. Like about simple basic things. Like forget like the big picture of who you are, but I think for me it's expanded out from there, and I see this with my clients as well, where you're asking the big questions about like partnership and your career and this and that and hobbies. But if the way that you got disconnected was someone like invalidating your emotions or denying your reality, emotions are in your body. So if that stuff was denied, that means you're experiencing your body is being denied and pushed away. So like the doorway back in then is like back into your body, back into your emotions. But it is not a straight line. That journey is not a straight line at all.
And I know that as you're saying this right now, some people are starting to feel uncomfortable because we're starting to talk about our bodies. And I've noticed in one of my episodes recently, it was more somatic focused, and some people just can't even listen to those episodes. It just makes it so uncomfortable. And what do you have to say about that?
Would say it makes sense. It makes sense that it's so uncomfortable. And rather than judging what you're listening to or judging yourself for having that reaction, like, can we get a little curious about like, why does it feel so uncomfortable? Those are those protective parts, like saying, don't go here. And they're there for a reason. So it doesn't mean that we just like listen to them and walk away, right? It's like letting your child drive the car. Like, yeah, go do whatever you want, but we have to respect that they're there for a reason. And that's a place to start getting curious without pushing through to whatever it's protecting, right? It's protecting something when we don't want to go somewhere. So that's a place to slow down and go, okay, let's get curious about this. And even noticing what comes up with the discomfort when you think about moving towards your body. What do you notice? And this is why having a noticing practice, we don't have to talk about mindfulness, but a noticing practice in some shape or form is so important.
I never, when people say they feel so disconnected from their body, I've never resonated with that. But what's been interesting for me in doing IFS work is that it's all in the limbs. It's always in my arms, on my legs, and there's a real distraction away from the core, And so we're trying to get there, and I've realized that like I've identified there is a an exile in the heart, in the chest area, the little girl who feels there's something wrong with her and she's unlovable. And I've realized that there's a protector there that's like, it's almost like the man behind the curtain. It kind of barks out all the orders to all the other protectors to just just stay away from here, stay away from here. And I've noticed too that, and I've always known this, and I haven't made the connection, but anytime I've done like body scan meditations, anytime it asks like to think about your heartbeat, like that has always scared the shit out of me. Like I have not been able to go there. So I do realize that there is some body disconnection, or I don't want to connect in, but it's interesting like going there and then just seeing all the different parts that come in. Like I have this one part that is it's kind of like the practical part that like is able to see things from like a 10,000-foot view. And it's just sees how great we are. And it's just like so annoyed at every other part that's just holding us back, That's just like, come on, like, what the fuck are we doing, guys? And then the critical part comes in, then the numb part comes in. And so.
But how amazing to be able to track.
Oh, I thought that this shit was crazy a year ago. I was like, it took me a while to buy into it.
I have a lot of people who have a reaction to like even just the term inner child.
Mm-hmm. Oh, I thought that was stupid too for a while. I
like,
knew that it was effective and necessary, but I thought it was stupid.
Yeah. Look, I'm a trained psychologist. When I first learned about this work, I had some responses to it too, which obviously is telling in the number of ways. But I was also trained to really prioritize evidence-based, like all the research-backed, heavily kind of manualized treatments. And this is so different. And what I share with people is that if it makes it more digestible, you really need to understand how talking about your inner child is actually just talking about your nervous system. It's just talking about it in a way that creates tenderness and warmth and something that's more relational rather than thinking about the physiology of your body. But they're not separate from each other, right? So think about your protector parts, like a part of you is pulling you away from a certain place in your body because there's something that might show up there if you go towards it. That's your nervous system protecting you, keeping you safe by doing something, right? When there's a memory that shows up, yes, we talk about it activates a younger part of you. What's that younger part physiologically? It's an implicit memory that your nervous system experienced and held onto, that's stored. So they're not, I know it for some people, if you're listening to this, you're like, inner child work, BS, not for me. It's actually very much tied to your biology, your physiology, and how all of that, your nervous system, everything is shaped by your attachment experiences.
I think ultimately it's unavoidable. I really do, whether it's parts work or inner child, and I still have so much work to do. That's the other thing too. When I started this, like I thought I was like so much further along than I actually was. I really thought I was doing good. And then I just like had a total meltdown. And I'm just kind of getting out of like a year of, oh my God, it's just been one thing after another, slipping into old patterns, abandonment wounds, this, that. But what I've come to realize is the parts work, I think, in inner child work is absolutely crucial. And the somatic piece is crucial.
And you need different modalities at a different time. And I say that to my clients all the time. It's like, I'm grateful I'm trained in a wide number of modalities so that I can flex and integrate. But
I was looking at your
promises
website.
you a one fix for everything, I would be very cautious of that person. Very cautious because, I think about healing as this whole pie, and you need different slivers of that pie at different times in your healing. Sometimes you really need to dig into that somatic work, really need to dig into inner child or parts work. Other times, some of that cognitive work actually can benefit you, or that's maybe even where you start because you're so guarded in your body. Sometimes you might need mindfulness or acceptance-based work. So it's all important, and it depends on what you need and what feels like the right fit for you.
Are you trained in, I can't remember what ACT?
Yes. Yeah.
Okay. So one of my friends, she's been working with a therapist that's one of his modalities. Can you
Mhm.
talk about that at all?
Yeah,
So
yeah.
it's acceptance and compassion therapy
And commitment
and
therapy.
commitment. Okay, what the hell is it?
Yeah. So it's a mindfulness-based therapy. There's a lot of similarities into self-compassion work and even into some parts work.
Okay.
But the core of ACT is to help you become more psychologically flexible, which we know is like one of the indicators of emotional health.
Mm-hmm.
What it really, I'll break it down in the simplest way, is that the experiences we've had in our life, all the programming conditioning that we've had, shows up in our sensations, shows up in our thinking and our belief system. And we get caught into taking those as literal facts about ourselves or facts about life. And that narrows our behavioral repertoire. It dictates what we do or what we don't do in our life, right? When you basically follow, we want to talk about trauma, follow your trauma narrative.
Okay.
So it uses mindfulness-based processes to help you get distance from your thinking, from your experiences, from your memories. So in parts work, for example, you'll talk about being blended with a
Mm-hmm.
part. In
Mm-hmm.
ACT, you talk about being fused with
Okay.
your experiences. And it still uses that same noticing practice that parts work does. And the goal really is to let go of this idea that we have to be different before we can go out and pursue our values.
Mm.
The goal is like putting the values first and bringing all those experiences along with us without having to change them, fix them, or make them go away. So it's really, really powerful in helping you just take a step back from all your experiences, your body, your sensations, your thoughts. And another piece that's similar with parts work, parts work talks about the self and self energy. ACT also, in its own way, talks about that. Is like, notice the noticer. Who's observing that thought? Who's noticing that body sensation? That is the self. It has different ways of working with it in these therapies, but they touch on a similar construct where the goal is really to be able to allow your experience to come and go and make your choices from a place of intention rather than a place of fear or conditioning.
Okay, so let's say, like, take me for example. I'll get super dysregulated sometimes when I'm about to make social media content, and I will literally spend 2 hours on a 7-second clip and get nowhere. And so leading up to that, sometimes I have that preemptive fear and anxiety leading up to it. So how would I be using ACT
Huh.
to help with this situation?
In that situation, I would be guiding you through really noticing what specifically is it that you're observing. So we would
Okay.
take a look at what's happening
Would it
in
be
your
like, would I stop myself in the midst when I start spinning out, or would it be like before I start doing it?
If you know that this is a place where that's going to come up, yeah, after you've done some of this work,
Mhm.
you can prepare yourself. And we
Mhm.
talk about that in DBT, which is another mindfulness-based therapy. It's like flipping ahead. I'm sure you're familiar with DBT. You know something's going to be a sticky situation for it, like you want to plan ahead. But in the moment, right, as you're learning this, what you do is you're literally stopping in the moment to observe what's happening for me right now. What does that dysregulation feel like? Where am I noticing it? And you're observing and describing that without getting caught in the story of it. And then you're separating out what's the story my mind is giving me along with that all that dysregulation. What are the fears? What are the thoughts? What are the beliefs? And then from there, what we would do is practice. There's lots of ways ACT does this, like meditation practices, metaphors, in the moment practices to give you some distance from those things while also helping to clarify, like, what's the value here? Like, why are you even doing this? Right. And bringing that to the forefront so that we can start to like shift what's driving the bus here,
Mhm.
essentially.
Mhm.
That makes sense?
Mhm. Mm. How how do you navigate what modality you're going to use with a particular client?
Yeah. A number of factors. Certainly it depends on like what they're coming in with,
Mhm.
what their goals are, what they've done in the past. Like, so if somebody comes in and says, I've done this in the past, I did not like that. If I'm trained in other things that would be a good fit, we talk about those other things. Yeah, so their experiences, like relevant symptoms, goals, and you have to factor in like cultural and personality factors as well, like what fits with someone's worldview or the way they move through the world. It's like if somebody has a big reaction to parts work or inner child work, like we're not going to push that on something. We're going to offer something else that is still effective, and that's the important thing. We're not going to just offer something to offer. If you're trained in something that's still effective, you offer the other options, especially with complex trauma. Complex trauma is complex, so is the treatment. It has to be integrative. So for me, my sense is I always want to start where there's an opening with someone. So if someone is like totally blocked from wanting to do somatic or inner child work, I'm not going to start there. I'm probably going to start you a little bit more in your head with some cognitive work and ease our way in a phased approach. So that's generally how we're moving through it. The way I work, I'm very transparent. Like when I do intake sessions is I give open feedback about what I'm seeing, what I'm hearing. And then we talk about like, here are the options and have someone be very collaborative in that process. Not all therapists do that, unfortunately. They just say like, you're coming to see me. This is the treatment I do. That's what we're doing. Sometimes I'll ask people, what kind of therapy have you done in the past? Like, I have no idea. My therapist just told me this is, we just did this. So I think it's important as a therapist, obviously, that you're discerning and thoughtful about that, but also like as the consumer, as the client, you should be part of your treatment as well.
Are there situations where you'll say like, I don't think I'm the best fit for you?
Yeah, absolutely. If somebody, sometimes it's a personality clash, rarely. The times that I've referred people out more so have been about the modality that's needed. Or it's like a phasing issue where it's like, you really need to do this kind of work before you come. This kind of work, come back to me afterwards. I think, and I'm not saying this about myself, but I think it's a sign of a good therapist when you're willing to refer out. You need to know field counselors. You need to know when, and you need to be educated on other modalities, not just the one that you think is the best in the world, because you need to know when it's okay to refer someone and something else is needed or something else can supplement the individual work that you're doing too.
How many people are coming in that don't realize it, or by the time they'd find somebody like you, they've already kind of figured it out?
No, that's a great question. I would say at least 30 to 40%. And I was thinking about this as you were sharing your experience with therapy, that I had this experience as well. It's so powerful when you have a therapist who's willing to give you education on something that they're seeing. I had the experience where I now understand someone saw something and didn't name it. And I think it could have opened up a lot more healing for me. And sometimes that's a therapist not being trained in something. Like
was it that she saw it and she didn't know what to call it, or she made a decision not to?
There's a specific moment where we were talking about a dynamic in my family, and she started to say, well, sometimes she started to say something and then pulled herself back. And I wish she had said it, because once that label was put on it, it opened up a lot of doors for me. Unfortunately, sometimes some therapists like don't have training and knowledge on something, which I see a lot with CPTSD and narcissistic parents specifically, where when I gently share that education, and I'm not here to slap a label on somebody by any means, like I can't diagnose somebody, but sharing about when you hear patterns over and over and over, it's a disservice to someone to not at least bring that topic into the room. Because once you understand something belongs to something, right? There's a name for something. These patterns hang together. This isn't a one-off. Like this is this kind of thing. You can work with it in such a different way. What I'm now coming to understand, and this is something I have seen in my practice, is the generational denial that perpetuates the patterns of things, whether it's this kind of trauma or not.
So what do you want to push? What do you want to shell? What do you want to share? What do you want people to know? How can people find you? How about it?
So if you want to work with me one-to-one, I am only seeing folks who live in the state of California.
Okay.
But for folks worldwide, you can join my 6-month Heal the Inner Child program. And this is an integrative program. It pulls from lots of different modalities.
Is it a
And
live thing?
it's a live thing, yeah. So
Live
you
virtual?
have pre-recorded video modules from me, audio meditations, a workbook, and then we have a beautiful weekly group call where you get like direct support from me and direct support from like-minded folks. And I can't underline how important that part is. And I'm sure you see this in your groups also. Most of us who've experienced trauma, it's so isolating. It's so shame-bound. And then to heal in a community,
It's necessary.
it's so necessary. It's so powerful. And I know oftentimes that's a put off for people who are like, no, I just want to do this in private. But I would say if there's a group program, whether it's mine or someone else's you're interested in, talk to that facilitator about that experience because it actually can be one of the most transformative things for you.
What did I say? This is a relational trauma. We heal it in safe relationships. So
it's individual work and it's your relationships. It's not an either or. It's definitely a both and.
I agree. Well, this has
You
been
have to throw out
great.
starter with this. If you wanted to start out with me, I have some master classes that would just give you like a little introduction to me as well. And then just lots of free content on Instagram.